Over the last 20 plus years, the single fastest growing segment of the IVD industry has been molecular diagnostics. Back in 1990, sales of the first molecular diagnostic test kits were a scant $10 million or so. By 2012, sales of molecular testing products reached a staggering $4.5 billion, representing more than 30% annual growth. Furthermore, EAC predicts that the market for molecular testing will climb past the $7 billion mark by 2017. So what is driving this phenomenal growth? Well, EAC sees 5 key market drivers. First, healthcare-acquired infections, or things such as methicillin-resistant staph, called MRSA, continues to plague hospitals. Insurance payers are exerting pressure on hospitals to adopt screening of high-risk patients for these pathogens, or they will simply refuse to pay the hospital for any cost incurred from these acquired hospital infections. Since the introduction of these molecular tests, sales have soared past $250 million, and we expect future strong growth. Second, the introduction of fully automated sample-in, answer-out platforms has allowed many small and medium hospitals to adopt molecular testing that was formerly limited only to the top-tier institutions. Third, companion diagnostic tests have been introduced to the market for cancer testing, such as the KRAS mutation test for colon cancer is driving growth in the cancer testing segment. Also, there is a rich development pipeline of new companion diagnostic tests that will further expand the market in cancer and genomic testing. The fourth market driver is the emergence of point-of-care, or POC, molecular diagnostics. Advances in microfluidics, DNA chips, and multiplex technologies has led to the introduction of several new testing products, and there are many more in development. And while true POC testing is still embryonic, these devices are starting to be used in stat laboratories and small clinics and gaining traction. In the future, we see doctors' offices adopting these types of tests for routine tests such as influenza and chlamydia, with the test being performed right in the office while the patient is still waiting. The fifth and probably most important market driver is the emergence of next-generation sequencing, or NGS. NGS is the ultimate game changer, as it will allow molecular laboratories to perform testing for dozens, even hundreds of genes or mutations in a single assay. And while still somewhat cost prohibitive, the cost of NGS continues to decline toward the so-called $1,000 genome. EAC has discovered that there are 40 to 50 molecular laboratories in the United States that have already adopted NGS for some clinical use. And while there are still many issues and barriers to be resolved before full-scale adoption, NGS opens up a world of opportunities in terms of disease diagnosis, detection of disease predisposition, disease prognosis, and proper therapy selection. Ultimately, next-generation sequencing promises to help the industry reach its goal of true personalized medicine.